The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified health provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk.
Welcome. This is Birth, Baby. Your hosts are Ciarra Morgan and Samantha Kelly. Ciarra is a birth doula, hypnobirthing educator, and pediatric sleep consultant.
Samantha is a birth doula, childbirth educator, and lactation counselor. Join us as we guide you through your options for your pregnancy, birth, and postpartum journey. Thank you to our listeners for your continued support. If you enjoy our content, please be sure to like, follow, rate, and review wherever you listen to podcasts. This helps us gain visibility to other people that could benefit from listening in. Hello, everyone. Today we have Carley Pearson with us. She is a DONA certified labor doula and lifestyle photographer who specializes in maternity, birth, and newborn photography. She grew up a river rat in New Braunfels, Texas. If you're anywhere from near her, you know what that means. And she moved to Austin in 2008 to attend University of Texas and hasn't left since. Friends describe her as warm, bubbly, and rock solid. I would say that's pretty accurate. And she takes her role as a doula very seriously and feels it's the greatest honor being invited into someone's birth space. And she's here today to share her lovely birth story with us. Thank you so much for being here today.
Thanks so much for having me on, you guys. It's so good to see you guys again. It's been so long.
It has been. We're so excited for you to be here. I remember you kind of starting your birth journey when you were pregnant and kind of watching it from afar in the group. So I'm excited to hear how it all went down.
Oh, thank you.
Yeah. So can you tell us a little bit about your journey of getting pregnant and then how pregnancy was for you?
Yes. So getting pregnant for us was not easy, unfortunately. We had it was quite serendipitous because I feel like I've really, through the years, I've been a doula now about 6 years, and I've really specialized in pregnancies that are maybe more complicated with IVF conception or different things like that. And then here I was having my own complications getting pregnant whenever it came time for us to grow our family. So that was really interesting. It was hard being on the other side. I have a great deal of respect and new understanding for all of our clients that do have that journey. So for us, after about a year and a half of trying, we discovered that I had PCOS, and it was actually through quite a bit of advocacy myself that I was able to convince the doctors, like, no, this is what I have, because you can't get diagnosed with PCOS via blood work. And so it was really kind of this complicated maze to try and figure out, okay, why can't you conceive? And I was like, I'm telling you, I'm not ovulating. And sure enough, we finally, did mid-cycle blood work, and they were like, and ultrasound, and they're like, oh yeah, you don't ovulate. And I was like, yeah, I know. And so
did you not know? You didn't know at all that you had PCOS before this? No other symptoms, nothing?
So I had the excessive hair growth. I have a lot of hair. I've always had irregular cycles. And I remember when I was 18, actually, an OB was at my annual, she was like, I was describing my cycles to her, and she was like, yeah, you might have a hard time getting pregnant one day, but we don't have to worry about it until then. So we'll just put you on the pill till then. And, being 18, this was way before I was ever doing birth work. It just never even occurred to me to get to the root of, well, wait, why are my cycles 60 days long? Why are my cycles 45 days long? Why am I ovulating 3-4 times and not having a rise in progesterone? What's happening here? And so whenever I went in with my charts, the OBs were like, yeah, maybe, but you don't really fit the criteria. And I was like, will you just humor me? Do a scan on my ovaries. I know, your job better than I do. Just humor me. And sure enough, there was cysts on my ovaries. Yeah.
It just takes the ego stroking to get them to finally
takes that little ego stroke.
Yeah.
I know. And I was like, okay, that's where being a doula really worked in my favor, because I do feel like I was able to navigate the system with our tips and tricks. And so sure enough, they did a scan, there was cysts in my ovaries. They discovered, of course, as I knew, I was not ovulating. Or if I was ovulating on like day 38 and then getting a period on day 42. So it's like you didn't have that long enough window to actually conceive, which also then led me to believe, do I need to have progesterone? Because I had a feeling I was low in progesterone. Like everybody would describe the second half of their cycle. And I was like, that's just not me. Like I feel completely like I have my ovulation energy my whole cycle. So like, I don't know what you're talking about. You know what I mean? So sure enough, I did more blood work and they were like, oh yeah, you have very little progesterone. And then on top of it, I was like, well, you just do a full thyroid panel. Once again, humor me. They're like, again, you have no markers for this. We did the non-invasive or whatever thyroid panel. It's probably nothing. Sure enough, they were in my thyroid and they were like, there's no way you can ever conceive with these thyroid levels. So we immediately started thyroid medication. We added progesterone and we actually did a timed intercourse cycle, which requires basically all the medications of doing like IUI, except your partner makes the deposit instead of the doctor doing the deposit for you. Not sexy. I mean, your partner sticks a shot in your ass. Yeah. And then is like, great, let's go have sex twice. You know what I mean? It's like literally the most unromantic process. And then, you go in daily for blood work and then you're still in the 2-week wait and doing all the things and you don't know if it'll work, et cetera. And so that was probably like the lowest point emotionally I think I've ever been in my life. I just really felt defeated. I really was like, will we ever be able to grow a family? This has always been a dream for us. It just felt really unobtainable and far away, and it was scary. But eventually, as we did the medications, which by the way I would describe them for me as like PCOS or like not PCOS, PMS on steroids. I was just like, whoa, like this does not feel good in my body being on those medications. So again, a great deal of empathy for people who do those processes for months and months and months. We got super lucky in the sense that I really believe because of my advocacy and because of the lifestyle changes that I made, I was able to reverse a lot of my PCOS symptoms. I added acupuncture. I added like anything cortisol spiking I took out, any dairy. I did like the full like elimination diet to a T, ate really healthy. My body was like in the best shape of my life. Like the way that my therapist describes it was like, you made getting pregnant your job. And I was like, that's truly what it felt like, and so we got super lucky. It worked on the second try because I really believe, the first try I was like, I didn't have enough progesterone. There's no way. And they're like, no. And I'm like, humor me. Let's do the micronized progesterone. If it doesn't work, we move on. It's fine. And they were like, fine, we don't really need to do micronized. And I was like, no, I've read the studies. The micronized has better success than the synthetic. Let's just do it. And sure enough, it worked. And then I had a hellacious first trimester where I was doing the Tour de France of vomiting around Austin and going to burst and stepping out to throw up. And that was really special. Yeah, I was like, the pregnancy glow is just my sweat from being sick.
I always laugh when people like, just like you read that like in a book, like, oh, she's glowing because she's pregnant. Like, what even is that?
She's definitely vomiting. Yeah. So I was like, oh my God. So first trimester was awful. I still was doing the suppositories of the progesterone. That like totally messed with my vaginal microbiome, made it like very sensitive to the point that like going to the bathroom and wiping felt like pins and needles. It was really fascinating. So that was like a really interesting side effect that I was not anticipating.
You can tell that you're a birth worker by how like in depth you are on all of these things. You're like, oh, this symptom was so interesting, and advocating for all of these things.
Yeah. I want people to know, like,
yes, I love it.
What it was like. You know what I mean? I'm not just like, yeah, I had progesterone, suppositories, and it was no big deal. It's like, No, it felt like you were wetting yourself every 20 minutes. And then it completely messed with my vaginal microbiome. Like,
Right.
because I had no idea that that could be a symptom.
I
So
wouldn't
I
know
was
that.
like,
Yeah.
yeah, I was like, oh, I must just have a yeast infection. And they were like, no, your candida is fine, but your microbiome is like very unhappy. It was fascinating. So yeah, but after I would say like week 15, I turned a corner and I was like, I could be pregnant for the rest of my life. And then we just went from there.
You deserved that.
Thanks.
Like, yeah, I worked
Paid
real
the
hard
price.
to be able to
Yeah.
enjoy some of this, please. Yeah.
Yeah, exactly.
So
Yeah.
once you got pregnant, lovely, what did you do? What did you do to prepare for your birth? And like, how did you choose a care provider? Because I'm sure for
Yeah.
you, like for anybody, that those are hard choices and they have a
They
lot of things
are.
but you know so much, already. So what was
Yeah.
that like?
So hilarious because being married to somebody who, like I said, I've been doing birth work for 6 years. He and I have been together for 8. So when we first got together, I wasn't doing birth work, but like I was a birth worker before we had children. And so he was very in the realm with me, right? Whenever I have a client on speakerphone and I'm listening to the contractions, he's right there with me a lot of times, as because we're getting ready for dinner or whatever. So he, I think, had more knowledge than I recognized, like the average person maybe did. But I really wanted to spend the bulk of our pregnancy preparing our marriage because I didn't feel as inclined I was like, I feel like being a doula was like the best internship for parenthood ever, at least for like the infant phase. Like the infant phase, I was not worried about. I was like, I every now and then do postpartum work. I've babysat forever. I, interact with my clients well into 6 months, postpartum. Like I have no concerns about navigating and how hard but short that newborn phase will be, but it could really jar my partner. And so I was like, let's do all the classes together so that it's like, I know nothing with you and we can experience this together. If you have questions along the way, we can talk about it. But I really, really, really want us to prepare our marriage. And so we did the Birthing from Within class, which is super focused on partner connection, your personal experience. You do a lot of art. You do a lot of just like self-exploration with the labor labyrinth to discover like, if we get stuck at this point in the labor labyrinth, how would that feel? One of my favorite things is we do like contraction bombs through it. So your partner walks up to you with an ice cube and is like, 5 minutes of contractions, let's go. And we do like 5 minutes of contractions every 2 minutes and we have to breathe through them. And it is such a fun way to like prepare your partner and you for how you really want to work as a team through labor, but then also having those really hard conversations for postpartum. And so I think my partner was definitely like, you overdid it with the classes. He was like, I did not need to take all of those. And I was like, yes, you did. But then it was so funny because once baby was born, he was like, oh, I'm really glad we took those. And I was like, yeah. But as far as picking a provider, that was hard because as a doula, I really felt called, maybe is the right word. I don't know, to hold our birth story really, really in loose hands. I didn't feel like it would be wise of me to think if I pick this provider and I want to have a home birth, for example, that's for sure going to happen. And so me being the planner I am, I was like, let's look at this from all angles. So we looked at, we broke down the cost of going the birth center route versus the home birth route versus the hospital route. And ultimately we discovered that the home birth route is not covered by our insurance, but the birth center route is, which means that in the event that we need to transfer, we are not basically paying double. And so we'll have already been applying towards our, out of pocket max so that whenever we transfer, if for whatever reason I need an unexpected cesarean, we don't end up paying $5,000 for our home birth and our out of pocket max, et cetera, plus all the things that come into play with a hospital stay and surgery. And so we opted for the birth center route. And then we live in the Allendale neighborhood. And so Austin area Birth Center North, right off of Duval, is right across, Mopac from St. David's North, which I felt comfortable with, but it's a 5-minute drive from our house. So I was like, I just think that's the best fit for us, traffic wise and everything like that, being mindful of that in Austin. So we went with them.
I love that you're like, I'm doulaing myself, and this is how I would help my clients be able to figure out what the right route is for them.
Correct.
And the whole thing about like holding in loose hands too, I think that sometimes, you've probably heard the nurse curse. People are like, oh man, labor and delivery nurses have the worst birth experiences.
I know.
It's just like, that's what they call it, the nurse curse. And it's almost like, sometimes I feel like there's a doula curse too.
For sure.
Because it's almost like we know too much and then we do all the things. And then, if it doesn't work out, it's almost more traumatic that it didn't work out.
100%.
Because you're like, but I knew all the things.
I know. Or you've seen all the ways it could go wrong and you're like, that would never happen to me. And then it does. And you're like, God, like no one is immune from this. There's a huge luck component. So knowing that and knowing how hard it was to get pregnant, it was like, we are not going to err on the side of luck. We are going to err on the side that I'm going to have a 3-day labor and end up transferring.
Totally fair. So how did labor and birth go then? Did you have a 3-day labor?
God, y'all, giving birth. I can't wait to do it again. It was the best day of my life. Aww. It was so magical. I feel so lucky. I woke up at 38 and 6, so 38 weeks, 6 days. I have a really long torso, and there was just room for baby. So I felt like I could be pregnant forever. Yeah.
I call tall people baby smugglers, long torso, baby smugglers.
For sure. Like I didn't look pregnant and I didn't feel 10 months pregnant because I had a long torso. And so I just had this little basketball that was like hanging out. And I was like, yeah, like I could be pregnant forever. So I really went into it. I know the stats. I'm like 50% go, by 40 weeks, 5 days. So I'm for sure going over my estimated due date. My birthday was a couple days after my estimated due date. So I was like, oh my God, how funny would it be if I gave birth on my birthday? And then I woke up on 38 and 6 and to a contraction. And I was like, oh, that's funny. And I just like went back to sleep and it woke me up, 10 minutes later. And I was like, oh yeah, okay. And so my husband wakes up, 30 minutes later and I'm like, I've been contracting. And he's like, what? And I'm like, no. It's no big deal. It's prodromal. It's going to die out. It's not real. Like, cause he was supposed to go to a concert that night. He was supposed to go to an Astros baseball game. This was on a Saturday that I gave birth, and he was supposed to go to the Astros baseball game on Tuesday. And I was like, you still have my blessing. Like, go to the baseball game. This is not real. This is going to be our life for the next 3 weeks.
The Astros in Houston, 3 hours away. That's for anyone
who... for our listeners not here. Yeah. Okay, let's just focus. Yeah.
It's fine. It's cool. Totally chill.
Cool. It's cool. It's like how whenever, my clients call me and they're like, I'm washing my hair and cleaning my oven. And I'm like, and you're contracting? And they're like, yeah, but it's not real. And I'm like, it's real. You're washing your hair and cleaning your oven. It's real. So, but the doula in me, I've just had so many first timers with prodromal labor. I've had so many first timers that go over their estimated due date. I was like, there's no way I'm going to give birth before my estimated due date. There's no way. I haven't had any contractions up till now. And so we got up and we let the doulas know, and I was just like, no, it's nothing. You guys go about your day. I'm going to Barton Springs later. Like, we're going to have a good breakfast and go walk Town Lake. Like, we'll keep you posted, but it's going to die out. I'm not worried. Well, at like 9:30, I went to the bathroom and I did have some bloody show. But again, I was like, it happens. It could have been my mucus plug. It's prodromal still. And at this point,
like
my
husband, second timer, the first go around, like, I don't know what I would do with you.
it was very confounding. My husband was like very stressed. He was like,
the best way to be though, the least amount of attention you pay it. That's what we tell people to do, but they just never do first time around. So, I mean, really, you were doing all the things right, because if you were sitting there focusing on it, it might not have stayed.
100%. It probably would have gone away, right? But no, you guys, we had like a wonderful bagel breakfast. We did the 3-mile loop at Town Lake. We're like stopping along the way and I'm breathing through the contractions. I'm like, I'm telling you, they're going to go away. And Evan's just like, you're in labor. And I'm like, I'm not in labor. I invited my brother and sister-in-law over for lunch because, again, I was like, I'm not in labor. It's prodromal. It's going to die out. So we get back from Town Lake and like they're on their way with juice lands. And I'm sitting on the couch watching Friends. I'm trying to get comfortable. And I'm like, I just can't get comfortable. And again, I'm like, I guess this is what they mean by like, you know, later in pregnancy, you start to get uncomfortable. And then all of a sudden, I just felt like I was peeing myself and my water broke. And I was like, oh, and I like pop up off the couch, rip off my pants because it's just this like flood of, you know, amniotic fluid. And I'm like squatting in this pool of amniotic fluid. And I'm like, Evan, he comes in and he's like, oh my God. And I'm like, it's okay. It's my water. It's odorless.
Terrorizing your husband.
Literally.
It's odorless and it's clear, she says.
Like, it's fine. There's nothing to be worried about. And he's like, I'm calling the birth center. And I'm like, you don't need to call the birth center. And I'm like, fine, my water did break. You can call the birth center and the doulas. And so he calls the birth center and the doulas are like, okay, well, she sounds like she's doing great. So like, just keep us posted, you know, because I was like, I do not need support. Like my brother and sister-in-law are on the way over for lunch. Like, this is not happening quickly. You know what I mean? So we call the birth center though, and the birth center is like, yeah, she's a first timer, so just keep us posted. And I was like, exactly. Thank you. Like what I've been telling everybody all day, you know? And so I like hop in the shower and brush my teeth because I've gone for that walk. And I get out of the shower and I have like a 45-minute long contraction. And I'm just like on my hands and knees doing horse lips, completely naked, of course, because I just got out of the shower. And my sister-in-law walks in and I'm like, hey, can you get me my TENS unit? And she's like, and so she like squats down next to me and I'm like, okay, here's where the pads go. So she puts my TENS unit on. I'm like, that's perfect. And she's like,
did you say 45? You said 45-minute. You meant 45-second contraction.
No, it was like 40, like it was like just like a 45-minute long contraction. Just like,
okay.
On my hands and knees. Like, It was just one of those like contractions where it was like the contractions and the pressure were just all in one. And so it never really let up. And so it just felt like you had to like horse lips through for about 45 minutes. And this is when my sister-in-law was like, you need to leave and we should not be here. And I was like, oh. And so she like, you know, I'm still doing my thing with my TENS unit. And my husband at this point is like, I'm just going to hop in the shower. We went for this walk. And I think because I had really convinced him, like, this is not happening quickly. He was like, he takes very long showers. My sister-in-law is like banging on the door and is like, Evan, get out of the shower. I have loaded your wife in the car with a bucket and cold wash rags. She's vomiting and you need to leave. And I was like, at this point, I'm in, you know, a diaper and a t-shirt, no bra, no shoes. You know, my hair's in this like bun on my face. And I am literally in the back seat on my knees, hunched over the back seat, just over and over and over again. And so Evan gets out of the shower and he gets in the car and he's like, oh my God. And we leave and we go to the birth center. And of course, at this point, we've called the birth photographer and the doulas because the doulas were going to come to us and they were like, never mind, we're going to the birth center. And then our birth photographer lived in San Antonio. So she was like, oh my God, okay, I'm leaving now. And so we get to the birth center and I like crawl from the car into my doula's arms and we just like migrate into the birth center together. I don't even think I opened my eyes like once and I'm still barefoot in a diaper, t-shirt, no bra. But you know, the birth center, it was a Saturday. There was nobody there. There was no, you know, it's pretty secluded. It's in this like little nestled place with trees. Like,
and even if it was, they need to see it, you know, like, let's just be real. Let's see what it looks
normalize
like, guys.
The fact that this is what it actually looks like when you're in labor. Yeah. So this is at like 3:00. So if we're tracking the timeline, like my water broke probably around like 1, and then I had that like 45-minute long contraction. And by 2, I was like, I don't know, I guess it's real. And then by 3, we were at the birth center. So we get to the birth center and the midwife is like, do you mind if we check your cervix? We just, we haven't done a check just to like see where we are. And I was really like, no, but kind of curious. And so I was like, you can check my cervix, but I don't want to know if it's not positive. You know what I mean? And so she checked, I like crawled onto the bed and she checked my cervix. Also, funnily enough, if anybody that's been to the birth suites at the birth center, there's 3 rooms at this birth center. And there's one that's like really small and it has a tub, but it has a queen size bed and that's about it, and a bathroom. And it's like tiny. And that was the room. I could have had my pick. There's like beautiful big suites with all this expansive space. And I was like, no, I want the tiny one. And I like crawled into the bed in the tiny one. It's just like where I felt safest. We had the, drapes drawn. Everything was really dark and lovely. And they checked my cervix and they were like, you're 100% face and, 6 centimeters dilated. And I was like, okay, that's positive. Can I get in the tub? And they were like, yeah. And so I get in the tub and I would say I was probably completely dilated by like 4 or 4:30, if I'm being honest. But the pressure was so big. Like it just felt, the pressure was, I was having a really hard time differentiating between the pressure and the sensation of baby's head and the opening of my cervix. That's really the only location I felt my contractions versus when a contraction was actually happening. And so I was having a hard time differentiating, and I was really just like in the tub with my eyes closed. And my husband, I wouldn't let him leave my side only because he had a fan about 4 inches away from my face this entire time once we got to the birth center. And he was our fan man. He said he was completely useless, but I was like, no, you're a fan man. And that fan man was very important because I was so hot. I was pawing at this bowl of ice water. And I was telling our doula, like, pour the water on me. Like, where are the washcloths? You know what I mean? Like, I'm just so hot. And so I would say though, like that pressure, I was like, if this is as big as it's going to get, okay. But if it's going to get bigger than this, like I remember at one point I turned to my doula and I was like, I don't know. Like, I think we should transfer. And she was like, Carley, you're going to have this baby in the car if we transfer. And I was like, no, I don't think so, but fine.
Well, because your doula brain is still telling you, I'm a first-time mom. I'm 38 and 6. Like, I'm not going to have a fast birth. We don't get fast births. Doula curse, right? Like, this isn't going to happen.
No, at all. And so I'm like, there's no way. I'm like, God, if we have another 12 hours of this. And of course, I really felt like I actually did a pretty good job of like pushing my doula brain away of the stats, right? Of being like, I'm going to dilate about a centimeter an hour. This will be the longest part of my labor versus the shortest part of my labor versus, the fastest part of my labor, like really trying to just push all of that stats and knowledge away and just stay really grounded in my body. But again, that pressure, I wouldn't even describe it as pain. It was just like, the pressure was just so big. And so at one point I like crawled out of the tub because again, I'm like so hot and I just like completely pee all over the floor. And my midwife at this point is like, I think you're ready to have this baby. And again, I'm like, there's no way, right? Doula curse. And because at this point it's maybe 5. And so she's like, if you just like roll over and open your legs a little, I can check to see if I feel baby's head and no more cervix and you're good. And then you can just do your thing. We don't ever have to check again unless you need me to. And I was like, okay. And so I did. And she was like, well, no wonder you feel so much pressure. Your baby is like right there. And so she was like, whenever you're ready to push. And I was like, ugh. And so I like squatted and I gave it like a test push and I was like, nope, we're not going there. That is big and that is painful and that is not fun. And I was like, I just need to sit on the toilet. I just need to sit on the toilet. And the midwife was like, you really want to have a baby on the toilet? And I was like, no, I need to sit on the toilet. And so I moved, I like crawled to the toilet. Once again, my husband's, right there with the fan the whole time. And my doula, bless her, is standing in the doorway, kind of being like my guardian so that I can just labor on the toilet. And I labored there for about an hour. I just was like, I know I can push. I know I know that is the last thing that I need to do to meet this baby. And the only way out is through, and we're going to do this, but I'm not mentally ready. And so I just gave myself about an hour to sit on the toilet, be with my husband, sit in the fan, pot some more ice water. Life was good. Laboring
That's so
through it.
beautiful.
Yeah. It was
I love
just
that you gave yourself that time instead of just rushing through it, because that's also where some people like come up with trauma is like, I felt like the shock of it's already over, and like you weren't ready for it to be over. Your brain said this is not over.
Ciarra, I wasn't even ready to like no longer be pregnant. You know what I mean? Like I was really like, that's it? Like this is the end of this pregnancy? Like I'm so excited to meet my baby. We didn't find out the gender until day of. So I was so excited to meet them and figure out who they were. But I also had just like loved having that security of keeping them in and being able to keep them safe, at all times. And so I was sad that my pregnancy was ending and excited. And it's like this weird dichotomy of feelings. And so finally, I guess around like maybe 6 or so, I wordlessly, of course, at this point, you're not talking. And I just crawled, I like got up and moved to the bedroom where they had set up the birth stool. And I just sat down on the birth stool without talking to anyone. And they had a mirror down there. And I just looked at the mirror and I was like, oh, that's not so scary. And as soon as I started pushing over the mirror, I was like, oh, yeah, here's my baby. And I reached down and felt them. And I was like, yeah. And I was able to like have that like mind body connection of like, whenever I do this with my body, my baby moves. And it felt really like gratifying and grounding and like exactly what I needed. And baby was born at 6:27. And they were, I would say one thing that I think is really important to know that's definitely like a doula thing is when I was crowning, when baby's head came fully out, 2 things. First of all, before baby's head was fully crowning, whenever baby's head was like, the little teardrop, my husband was like, oh, their head's so small. And I wanted to kill him. So there was that fun little note.
Like you tried it.
Yeah, I'm like, And then he said that on the next push, it was like, and like the whole head came out and he was like, it's not small. That was really funny. I know. And then, but the second thing that happened is whenever I crowned, I tore a little bit. And I tore up near my urethra and I tore slightly down back by my perineum, just the littlest bit. But it felt like somebody had put a hand in the inside of like my vulva, right by baby's head, which a lot of OBs do. They will like, stretch the perineum or put their hand in between the perineum and baby's head. And I made it very clear I didn't want anyone to touch me when I was pushing. And I really wanted baby to do all of my stretching. So when I tore, I thought it was my midwife's hand and I pulled away from the baby. And so it actually tore me a little bit more. She kind of like the baby kind of came out in this like kind of funky-ish angle because of it. So then the midwife did end up kind of needing to help a little bit because I was really wanting to catch the baby. But this kind of like took me aback. And so then the midwife ended up catching baby and bringing baby straight to my arms, and I was on the birth stool. So I just brought baby straight into my arms. And then baby was pretty stunned, which I also knew was totally normal. No one in the room was alarmed by baby being stunned except for my husband, who was like, why aren't they breathing? Why aren't they crying? And I was like, give them a minute. Like, they're fine. And sure enough, within, 30, 45 seconds, baby had started clearing their lungs, was totally fine. But at this point, we peeled back the little legs and I looked at my husband and he was like, is that girl? And we just like lost it. And that was so fun. And I had a feeling it was a girl, and we'd had our girl name for years. And so we were so excited. And not that we wouldn't have been excited about a boy, but I think it just felt like, yeah, that's exactly who I thought I was going to have. You know what I mean? And then shortly after I birthed my placenta, we just kept it attached. It was in a bowl. It just kind of like hung out with me, or maybe it was even just in a on a peri pad. And but it just like hung out with me. We migrated to the bed at some point so that they could do an inspection of those tears. It was only a first degree tear, but they did end up needing to do some repair because, interestingly enough, I had some inner tissue come out with baby. And so they actually had to remove that tissue. And it kind of was a more complicated tear. It was a more complicated repair that took about an hour. So they actually had to have a more senior midwife come in to do it, which was interesting. And I would say, like, at that point, then I felt the afterbirth contractions. And that's whenever I was like, that hurts. That is painful, because the pressure was gone, you know? And so then I was like, oh, that sucks. And so we were immediately like tincturing it up, you know, all the things. But it was so amazing. I would say by like 9:30, I'd ask the midwives, when can we go home? And we were home by like 12:30.
Oh my gosh, I love it. I love it.
It was hilarious.
That's amazing.
It's also funny that you're like, okay, well, like, great, I had an unmedicated birth, but like, now what can we do to help mama out? Because, you know, I'm uncomfortable.
No, truly. I was like, now this sucks. And my afterbirth contractions were painful for about a week. I was like, these suck. Like, every time I latched, every time, you know, I moved, I had wanted to do the 5-5-5 rule, but I wasn't like completely married to it. And then I was in so much pain. Like, I was married to it. I didn't start, you know, I think the first time I walked down the street, I was 3 weeks postpartum, because my pelvic floor just felt like it needed to heal.
Yeah. Just in case anyone listening hasn't listened to some of our other episodes, 5-5-5 is 5 days in the bed. So like reclined, 5 days on the bed. So still not getting up and moving. And then 5 days near the bed, around the bed, like not going too far. So this was the thing that you felt really prepared for, was postpartum. You were like, I'm ready. I've got this. I'm not worried. My husband probably needs a little coaching, but we're good.
Yeah.
How did that play out?
Great.
Just like you thought?
So fun. Yeah, it was so much fun. I was so blissed out. I was just in this like oxytocin bubble. I think like on day 3 postpartum, we finally were alone, just the 3 of us. And I just started sobbing tears of joy and gratitude and just love and appreciation for my body and our family and this baby. And I couldn't believe that she was here and real, and all of our hard work had been so worth it. And I really felt like it was exactly what I thought it would be. It was broken sleep and covered in milk, and my body odor was out of this world, and my baby loved it. And it was just everything I wanted and more. Our bed just became like the center of our universe. It really did. We took all of our meals in there. People just came in there to us. We chose a pediatrician that did home visits. We chose lactation that did home visits. So the only thing that I had to leave for was my midwife check-ins. And even that, I would just, you know, basically you just walk from the car straight through a door and you're there. So it was no problem. The point that postpartum really changed for me, and this is where I always like to tell families this, because this is what took me aback. You know, they always say like postpartum's forever, postpartum's 2 years, postpartum, you know, you may not feel like yourself for however long. And my daughter did have a lip and tongue tie. We did get it revised at about 3 weeks postpartum. She ended up forming torticollis. So we had a couple hiccups in the first 4 months. So then we had to do PT. So because her head was starting to flatten on one side. But again, none of these things felt too big. They really didn't. But it was 4 months almost on the dot postpartum that things shifted for us and got really hard. So we had our first sleep regression, and then it just snowballed from there, where my daughter started to decide that she basically wanted to feed, the bulk of her feeds overnight. Um, so we went from, she would go down, let's say at 9, maybe wake up at 1, and then again at like 4, but then we'd start our day at 8, which is like, basically you're just feeding and baby goes back down. That's like the newborn cycle, right? To basically, she would take about 2 hours to go down. She was miserable. And then she would, from midnight to 6, just want to eat every hour. And that went on way longer than it should have. I finally decided to combo feed at about 9 months. And I do think that did help. But like, it did help her belly, I think, overnight a little bit more. And we were able to kind of like flip her clock back. But I was really hell-bent on, really wanting to I really didn't want to do any sleep training methods. And I definitely not paid the price for it, because I know that some babies don't need that. But like from 4 months to 12 months, we did not sleep. And it was so hard. And as a result, that's whenever my body, when some people might be able to start reincorporating exercise, or, starting to get reacquainted with themselves postpartum, I was essentially completely going backwards, because I was so exhausted that during the day, if I had any downtime, I was sleeping. And I was working while popping during the day. So I was with my daughter during the day and at night, so I was getting no breaks. I had occasional help, but nothing consistent. It was just a hot mess. And so that's when our postpartum was really hard.
That's so hard. I'm so sorry that got so difficult. It really is just like some babies really do so well at the beginning and then struggle later, or some are the opposite and they struggle real hard at the beginning and improve later. And it's just like a mixed bag. We don't really ever know what to 100%. Expect. I feel like that's just like the biggest mom lesson that we get to learn. And we can, plan and we can know all of the things, but our babies are going to tell us what they need. And, 100%. Jokes on us if we think we can control them, as I get to learn every day with my spicy 5-year-old.
Exactly. And I would say that spicy is a great word to describe my daughter too. And so, she's definitely always been, at 4 months, she started refusing the breast because she was full. She's one of those babies that's like, if I'm not hungry, I'm not eating. And she still is like that as a toddler. She's like, if I'm not hungry, I'm not eating. And so she's just always looked for how and what she can control to give herself that, independence and control. And it's everything I want her to be as an adult. And it's everything that makes parenting hard. You know what I mean?
And I talk about this all the time. We are raising strong, independent women. We would just love for them to be a little bit less independent right now.
Just a little compliance. Can I just get a little compliance?
Can we be a teammate here? We have the same goal.
I have a 14-year-old. 14. She's going to be 15. And yes, a month and a half, 15. And it is wild, the entire time. It never stops. And it's true. And I've always said I have to out nurture her nature, because her nature is just defiant. And you could ask her, do you want ice cream? And she was like, no. And then she'd realize what you were asking. She's like, yeah, I do. But immediate no,
100%. Absolutely. Absolutely. Yes. I totally hear you.
We love our spicy girls.
I know. They're, one of a kind. They're so special and truly everything we want them to be as an adult. But man, does it make parenting hard.
And the reason that we can all go to the hairdresser and get our grays dyed.
Correct. Exactly.
I'm embracing my grays. I'm not doing it.
I love that. Here for it.
Amazing. So with all of that, it sounds like that first year was really just, intensive, survival time. Yeah. You mentioned that you were working a little bit. Were you back to doula work at that point?
Yeah. So I went back to work around 5-ish months. And actually I went back to work a little bit before that, because I did have a couple repeat clients that had quick births that I was like, I'll take you at 2-3 months postpartum. And their births were great. And those were a breeze. And then my busy photography season's the fall. And so I did jump back in for busy photography season through the fall. And then I didn't really start taking births. I think I started taking like only repeats, 1 or 2 a month, starting in like January. So my baby was born in May. So that felt more manageable and it felt exciting, you know what I mean, to like have this other portal into like other things that I'm passionate about, you know. But in hindsight, I was like, we needed more help if I was going to be working. We just did. Like realistically, it just wasn't sustainable. And we had talked about it. My husband was the one that was like, you need help. And I was the one that was like, I can do it all, you know, as we do. And so it's hard to say. And then the summer was pretty, so she turned 1 in May. And then the summer, we really took the summer. I usually take it pretty light with clients anyway, just because the days are so long. It's like a great family time. We do a lot of trips. And so I just kept things super light in the summer, and we were able to really like hang out in the summer and play and go to all the splash pads. And she was more mobile, which was really fun. We got a handle on her sleep, got a handle sort of on her food. And I also was like, we can keep breastfeeding as long as you want. But I really felt that pressure of feeding go away when she turned 12 months. And so it made it way more fun too. And so, you know, if she only nursed for 5 minutes in the morning and 5 minutes at night, I was never worried. Versus, you know, before that first year mark, I was like, oh my God, she's not getting enough food. What's going on? She's not going to sleep. You know, I would just, you know, spiral myself. And so when we hit a year, I was like, we can keep going as long as she wants. And so I was just taking cues from her, and she got really into it again at a year. And I would say from like a year until we weaned, she was like super jazzed about it. And she would do these like drive-by sips. And then it was like one day we just woke up at like 15 months and she said no. And that was it. And she just like weaned herself. And so that was really wild. And then that was really when I felt like my pregnancy ended. That was really when I was like, oh, there I am. You know what I mean? And that felt really, really refreshing. It was sad to move on from that phase, but I also felt like she was ready and I wanted to honor that. And in a weird way, I think I was ready too, you know, and so it was okay.
Yeah, that's always such a transitional period. I remember that with my youngest. I think that was where I felt it the most. With my oldest, I was pregnant again, and so it was just like, well, I'm just done with that one and on to the next.
For sure.
But with my daughter, she weaned herself right in the middle of snowpocalypse.
Oh,
and
wow.
like the beginning of it, and she's like, yeah, this feels like a good time, which again goes to her spicy nature. And that was like a really
like, we don't have running water. You better drink the milk.
That's what I was like, what is your problem, child? This is like the worst possible time.
My God.
But that fits her. But it's such a weird time. But I remember coming out of that after being, you know, pregnant with my son and then breastfeeding him, and then immediately pregnant with my daughter and breastfeeding her. It was, I mean, nearly 4 years of just like back to back, like in that hormone cycle. And I came out of it and I was like, oh my gosh, is this what it's like to be like myself again? This is crazy.
Yeah. Oh, for sure. I mean, I think I dropped a pant size in like 3 days or 4 days after I weaned, because I have one of those bodies that was just like, hold all the fat for the milk. And so I was actually, when we weaned, and even up until, you know, recently, I was the same weight that I was 10 months pregnant. You know what I mean? Like, and I think that was also, that's like a big misconception, right? Of like, oh, just if you breastfeed, it'll just fall off. And it's like, no, everybody's body is different, you know?
Yeah.
My body,
I try to tell people that a lot.
Yeah, exactly.
Yeah. Did this change the way you doulaed when you went back to work? Do you feel like you're a different doula, or do you feel like... What'd you
Yes.
say? It did.
Oh my gosh. Yes. Oh my gosh. Yes. Okay. So I would say in the beginning, I had a really hard time going back to hospital births. I was like, stop touching them. Like I knew what that felt like. And so I was like, that's really painful. Like I remember I had a birth, an unmedicated birth. And when she was pushing, the nurse went to go press on her perineum, like they do a lot of times when you have an epidural so that you can feel the urge to push. And I was like, she doesn't need that. But sure enough, as soon as she just like pressed on it, like she had an epidural, my client screamed. And I was just like, chills, you know what I mean? Because I was like, I know what that feels like and it's horrible. And, so
It's
that was
different
really
when you
hard.
have felt it, right? And when you
Yes.
like, there's a different, that just made me think of a time where I was working with a couple where it was two women and the
Yes.
birthing mother was giving birth and the other one was seeing what they were doing to her with an epidural. And
Yes.
the other one was like full body flinching, like, oh my
Yes.
God, I have a vagina. I know what they're like. Oh my, I can't even imagine
Yes.
what that would feel like. So you already have that just as a woman, but then the
Correct.
added of like, I have experienced now what they're doing, or like even without, but I know what that would feel
Mhm.
like now
Yeah,
is like just this extra level.
it is. And it makes you really protective in a weird way where you're like, oh, you know what? Listening to her body, it sounds like she doesn't need that. It sounds like she knows exactly where to push. You know what I mean? And the nurse was like, oh, I've never had to not support someone's perineum when they're pushing, which was, so it was like a good, and it was a really enlightening experience, right? I think you can like talk about physiologic birth all that you want, but until you've experienced the physiologic birth, it's sort of one of those things where you're like, no, you don't need help learning the sensations. The sensations are there. Like your body, your uterus is pushing the baby out, not, you know, your pelvic floor. Your pelvic floor muscles are getting out of the way, right? And so it was it was like I felt a deeper understanding of that. So in the beginning, I think it was hard for me to like see those things again. I would say further away from it, I'm starting now, it's more of like looking at the bigger picture for my clients, right? Of, okay, I spend a lot more time talking to them about postpartum. I spend a lot more time talking to them about, you know, the variations of normal that could occur within labor or the variations of normal that could occur in prodromal labor, right? Or what that sensation may feel like or different things like that. Granted, my labor ended up not being prodromal, but I would say those early contractions are the equivalent of those prodromal labor contractions, right? Where they're kind of this just like dull cramp that just sort of hangs out for however long and then goes away. And so talking to my clients kind of about that sort of stuff, I think I also am able to, it, I really have like a deep respect for their birth journey. And so not that before I really have always tried to be intentional about never putting myself into their birth story because I recognize that a birth could be super traumatic to me and then I'll process with them afterwards and they're like, that was the best day of my life. And you're like, wow, it just goes to show you that like we're all triggered in different ways. Like, you know, how one person could respond is totally different than how I could. And so I would say now being on the other side after giving birth myself, I feel even more of that, like, this is not my journey. This is yours, you know, and really validating their experiences and telling them what a good mom they are and what good parents they are and what a good job they're doing. And I never show up empty handed to their house now. You know, I always bring coffee and pastries and all the calories. And, um, you know, it's one of those things where it's like, I definitely have more of a like, oh, you need sitz bath? I'll go make it. You know what I mean? Like I'm way more of like an urgency versus like, oh, if she doesn't get the sitz bath for 3 days, it'll be okay. You know, and now I'm like, no, she had a big tear. I'm going to go home and make a batch and deliver it to the hospital. You know
You're
what
a
I mean?
mama bear, mama doula.
Correct. Exactly. So I feel way more of the like, how can we ease your discomfort? Like, you know, I think too, it's like, I recognize now what a sacrifice parents make for their children, you know, in a way that I just didn't before. I had no idea how all-encompassing it is. They say you're never going to break. It's the most thankless job. It's all those things, but living it has really given me a whole new appreciation for it.
Yeah, absolutely. It is. There's so many nuances to all of it, but I think specifically like doulaing when you have children, you have to really kind of process things in a totally different way.
You do, absolutely. Or, whenever you work with a client that has a loss, or when you work with a client that, has a really hard birth with a difficult outcome or whatever it may be, I mean, you just feel it in a different way. Your heart breaks in a totally different way. And I still am, and that's why we as doulas go to therapy and have our community, right? So that we can decenter ourselves from their experiences. That's so important. And I'm always trying to focus on that and do that. But it's whenever I step back and when I do my own processing, I'm definitely able to recognize, oh, that triggered me. Oh, that was hard for me because of this, and things like that.
Absolutely. Absolutely. Well, thank you so much for coming on and sharing all of this. This has been so great. Would you like to share your social media and website with our listeners that might be interested in learning more about you?
Absolutely. So my name is spelled Carley. And my middle initial my middle name is Elizabeth. And so it's Carley E Photography. No periods or anything. So it's just Carley E Photography. That's my Instagram. www.carleyphotography.com is my website. And I am offering, if you mention this podcast episode, I'm going to offer all of those peeps that mention it in their inquiries a little discount. So definitely a little incentive for listening for you guys too, but then also for the clients. I want to give them a little love. And
we'll have that in our show notes too. So I was like amazed when you sent that over. I was like, ooh, that's a good offer. So be sure to check out the show notes. Thank you so much for being here, Carley. We loved hearing your story and catching up with you.
Oh, thank you so much for having me. It's been such an honor.
Thank you for joining us on Birth, Baby. Thanks again to Longing for Orpheus for our music. You can look him up on Spotify. Remember to leave a review, share, and follow wherever you get your podcasts. See you next week.